And before starting the class, please subscribe to our channel and follow us in Instagram for notes. And till now we have completed the upper limb, and now from today onwards we are going to start about the lower limb. And before starting the concepts regarding lower limb, so today is the first class, and in today's class we will discuss about what is the important concepts that is related to this upper limb. What is important concepts that is related to this upper limb? Now coming to the point, first chapter is about bones. About bones. See, please note down in your book, so it will help you for further. In the bones, first we have to refer about hip bone. In the hip bone, we have to refer to iliac, pubis, and Next, the first important bone is we have to refer the hip bone, and then the first important thing is femur bone. Femur, patella. In the femur, there is upper end as well as lower end. There is upper end as well as lower end, and patella and tibia and fibula. In the tibia and fibula also there is upper end as well as lower end. Upper end as well as lower end, and fibula also there is upper end as well as lower end. See, each question that includes 5 marks. 5 marks. Each question for 5 marks, as well as tarsal bones. Tarsal bones are for 2 marks, and in the tarsal bones, calcaneus. Calcaneus, either it may be asked in 5 marks as well. Calcaneus or calcaneum. Okay, it will ask for 5 marks as well. These are the important bones that belongs to this chapter bone. Next, coming to the front of thigh. In the front of thigh, the most important concepts of the front of thigh is femoral triangle. Femoral triangle, most important, as well as along with femoral triangle, we femoral sheath, femoral canal, femoral artery, femoral nerve, and muscles that related to this front of thigh. Muscles that is related to the front of thigh. These are the 6 concepts that are important for 5 marks. These are also for 5 marks. These questions are important for 5 marks. And next, coming to this, we have completed the front of thigh. And next, coming to the muscles, that means medial side of the thigh. In the medial side of the thigh, all the muscles that belongs to medial side of the thigh is important for 5 marks. See, all the muscles are not much important, but we have to refer all the muscles because all these muscles are included either in a Viva question or as well as in the 2 marks or as well as in the 5 marks also. So in this concept, we have to study about obturator nerve. Obturator nerve for 5 marks. This is for 5 marks. Important question, mostly asked question. Next, coming to the gluteal region. See, in the gluteal region, muscles are very important in the region of gluteal. So any muscle can give for 5 marks. We will discuss in the class. Gluteal muscles are very important in the region of gluteal region. Next, coming to the popliteal fossa. Chapter name popliteal fossa, 6th chapter. In the popliteal fossa, see, entire popliteal fossa is more important for essay answer as well as 5 marks. Most frequently asked question. Popliteal fossa is important for essay answer as well as in the 5 marks. Mostly for 5 marks. It is asked mostly for 5 marks. And in the popliteal fossa, there is popliteal artery also. This is for 5 marks. See, in this chapter, in these 2 questions, 1 question will come for the examination purpose. Next, common perennial nerve. Common perennial nerve is important for 5 marks. In these 3 questions, 1 question will come for, one more is there, that is anastomosis. Anastomosis around knee joint. Anastomosis around knee joint. This is for 5 marks. In these 4 questions, 1 question will come for the examination. Anastomosis around knee joint. So we have to be careful of these concepts. Now coming to the back of thigh. So while coming to the back of thigh, the muscles of the back of thigh is very important. Muscles for back of thigh will ask for 5 marks. And in this concept, muscles, sciatic nerve, most important question, sciatic nerve, for 5 marks or 15 marks. In one paper it will come for 5 marks, in one paper it will come for 15 marks. So it is most important question. We have to study it for in this chapter, muscles and sciatic nerve. In these two concepts, sciatic nerve is the most important questions and frequently asked questions. It may be come for exam for 90%. Next, coming to the front of leg. See, in the back of thigh, I forgot to tell, in the back of thigh there is tibial artery. There is tibial artery as well as dorsum of foot. These two are so important for 5 marks question. Tibial artery as well as dorsum of foot. Next, coming to the front of leg. See, in the front of leg, just we have to refer the front of leg. Muscles of the front of leg is important. In the front of leg, muscles are important. We have to refer those. And the next, anterior tibial artery. Anterior tibial artery also important for 5 marks. As well as deep perineal artery is important for 5 marks in the front of thigh. Deep perineal artery. Okay. Next, tibial artery and dorsum of foot is involved in this front of thigh. These are the important concepts that regarding to the front of thigh. Next, coming to the back of leg. Coming to the back of leg. See, in the back of leg, the muscles of back of leg, we have to refer the muscles of back of leg. See, in the every concept, we have to refer the muscles of each and every concept, either in upper limb as well as in the lower limb also. So muscles are important in the back of leg. In this concept, posterior tibial artery is the most important question for 5 marks. Posterior tibial artery, most important question for 5 marks, as well as peroneal artery. Also important for 5 marks, as well as tibial nerve. These three are most important for 5 marks. Next, coming to the sole of foot. In the sole of foot, we have to refer the muscles. In the sole of foot, we have to refer the muscles of sole of foot. That is enough for it. Next, coming to the point of joints. See, in the joints, we have to refer hip joint, as well as knee joint, as well as ankle joint. In these three questions, one question will definitely come for the examination purpose. These three are for 15 marks. In these three questions, one question will come for 15 marks in the examination purpose. In the examination, one question will come for 15 marks in these three questions. So it is most important concepts. As well as in the upper limb also, the joints are very important. In those three joints, that is shoulder joint, elbow joint, as well as wrist joint, one question will come for the exam. Okay, these are very important regarding lower limb, and we have to concentrate these questions. And next, we have to refer each and every point in the book, but in our HAPM lectures, what we have told in this class will be referred, will be explained in the class and will be provided in the notes. And in the notes, some external questions also will be provided. I will try to provide all the external questions. Even in the upper limb also, I am providing all some important topics that are not explained in the class also. I am providing it in the notes. So please watch the video completely and go through the notes. It will help you a lot. First, watching video will help you to get the knowledge about the concept up to 70%. Okay, thank you all.